Very cool. All right. Well, for those of you who are new here and don't know me, my name is Courtney. I'm one of the content creators here at NCLEX Bootcamp. And today is going to be kind of a fun live demo. So if you're thinking about using Bootcamp to study for your NCLEX, you're in the right spot, because today I'm going to take you over onto our live site and show you all of the great resources that NCLEX Bootcamp has to get you feeling really comfortable and confident and ready to be successful on your NCLEX. So it is 1 o'clock, so we will get started. I want to first introduce you to Dr. Emily. She is moderating in the chat, so you'll see her messages popping up. She is there to answer any questions you might have. So if you have questions throughout the webinar, or if you just want to pop in and say hi, make sure that you leave her a note. She's going to be dropping some links throughout the presentation as well. That are going to be really helpful for you. So be sure to pop in there and say hi to her. So like I said, my name is Courtney. I'm one of the content creators here at NCLEX Bootcamp. I have been a nurse for 15 years and a nurse practitioner for 7. So I definitely know how stressful it can be getting ready to take your boards. So without further delay, let's hop in, and I'm going to show you all of the great resources that NCLEX Bootcamp has to offer. So before we get over to the live site, I want to tell you a little bit about who Bootcamp is. So we have here a group of nurse educators that come from every nursing specialty you can think of. We have maternal, OB, we have nurses from the ER, nurses from critical care, mental health, pediatrics, and so we've combined all of our expertise together to bring you a study resource that really looks and feels like the NCLEX, and a study resource that will really help you prepare and be successful when you sit to take this exam. So the biggest question I get from nursing students, so you just graduated nursing school and you're like, whew, that's all done with, and you're very relieved, but then you start thinking like, oh my gosh, now I have to take the NCLEX, and where do I even start? Because trying to compile all those years of nursing education and kind of restudy for all that seems like a really daunting task, right? We have come up with some study schedules for you to help you figure out where you should start, what you should do, how you should pace yourself, because we know that can feel really, really overwhelming, especially when you're feeling stressed out and studying for the NCLEX. So the first thing I want to show you is I'm going to take you over to our live site. And so this is what NCLEX Bootcamp looks like. And so you will see in the left side panel here, you will have everything that you need. So if you scroll down, you are going to see our study schedules right here. So if we click on that, you will see that we have 1 month, 2 month, and 3 month study schedules. So depending on when you're taking the NCLEX, you can pick whichever one is going to work best for you. So say you're going to take your NCLEX in the new year, maybe sometime in January. So you will find a really great fit with our 1 month study schedule. And so if you click on that, all right, you can see what this looks like. So it gives you a week by week breakdown, day by day, and you can see that it's going to tell you when to do what. So you're going to start off by taking a readiness exam. Oops, I'm sorry. You're going to start off by with our first next generation approach course, and then you're going to start with a readiness exam. You're going to review some cheat sheets and start right off with our case studies. So I'm going to walk you through each one of these components so that you can see what they look like. But this is a really, really great resource because it breaks it down into really manageable chunks. And by the time you get to the end of it, you can walk into the NCLEX feeling very confident that you have covered everything that you need to know, that you didn't miss anything, and it's not going to feel completely overwhelming when you're trying to study, because you'll go in, say on Wednesday, and I'm going to do case studies 3 through 6, 60 adult questions, 20 farm questions, and you're done for the day, right? That seems pretty manageable. So students really enjoy that. All right. And then, of course, you're going to see it says to take our next generation course, which is, if I go back here, you'll see right here above our study guides is our next generation course. So this was made by Dr. Emily, who I said is in our chat today moderating. And she has done a really fantastic job covering everything you need to know about the next generation NCLEX, because I think some students still feel a little anxious about the next generation NCLEX because it is still somewhat new. So she covers the basics and all about case studies, because we know the next generation NCLEX has case studies, right? So she's going to walk you through how to approach the case study, and then take you through a full-length case study and talk about how to approach that in a way that feels manageable and in a way that is going to allow you to be successful. All right, so if we're following our study schedule, the first thing you'll notice is that it tells you when to take certain questions. And these are going to be our standalone questions that come from our comprehensive test bank. So if we click on this, okay, you can get to our standalone questions from a couple different places. So you can come to here on the left side panel where it says standalone questions, and you can click on those. And say on your study guide, it says that you're supposed to do 20 adult health questions today. So you would just go to adult health, click on create a test, and select that you want to do 20 questions. And that will take you right to where you need to be. Same goes for child health, critical care, fundamentals, all of that. The other place you can go is right over here where it says create a test. And I like this tab personally because you can really customize. So there's a lot of different things you can toggle on and off. And you can pick from the subjects that you want to do or want to pull from in our question banks. And you can either use unused questions, or you can use all the questions, which might be questions you've seen before, or you can pull from your tagged questions. And I'll show you what that means in just a bit. So let's look at a couple questions, and I've bookmarked some for you today so we can answer at least one of them together. So I'm going to hit start test. And I want to show you a couple things. Let's do this one. So let's answer this one together. So I'm going to ask you to help me out here in the chat. So in this question, we have a nurse who's assessing a client diagnosed with major depressive disorder, and their dose of fluoxetine was increased yesterday. And now we're being asked which assessment finding is most concerning. So this is kind of a prioritization question, right? We could say that all of these are concerning, but we're looking for one that is most concerning. And let me just get the chat over here so I can see you all. There we go. So we're being asked which one is most concerning, which in my mind, I typically think which one is most likely to be life-threatening, right? So I'm going to have you help me out. So first of all, I think we need to ask ourselves, what do we know about fluoxetine? Does anybody know what kind of medication this is? See a couple of you guessing answers. So this is a selective serotonin reuptake inhibitor, right? An SSRI. And we use these to treat depression and anxiety disorders. So what do we know about SSRIs? What do we know about common side effects of SSRIs? Let's start there. Yep. So SSRIs, we know that GI upset is really common, like nausea, diarrhea. We know that headaches could be common. We know sexual side effects are common with this class. And how long do SSRIs take to start working? Do you know? They take a couple weeks, right? So they're not just an overnight fix. They take a couple weeks to start working. And then what's the big thing we worry about? I see a couple of you are mentioning it already. The big thing we worry about with antidepressant medications like SSRIs. We worry about serotonin syndrome. Yep, you got it. Okay, so when I think of serotonin syndrome, I think of sweating, shaking, and strange behavior, right? My 3 S's. So I think with all of that we've kind of know about this class of medications, I think we can answer this question. So we talked about nausea is a common side effect, headaches a common side effect. We said that they can take several weeks to start working. So if this dose was just increased yesterday, reports of low mood wouldn't be unexpected, right? Because it hasn't had time to kick in. What do we worry about with beads of sweat on the forehead? We're worried about serotonin syndrome, right? Sweating, shaking, and strange behavior. So I would say this is most concerning, right? Because serotonin syndrome can potentially be fatal. And I see a lot of you are getting it right. Now, I see a couple of you selected number 3. Now, I would be more concerned about this if the client was saying they were suicidal, and then that would be a safety concern, and then I would be most concerned about that, right? But because they're just saying that they have a low mood, that's not unexpected, right? Because fluoxetine can take a couple weeks to start working. All right, so good job. So, okay, so when you select the answer that you want, you're gonna go ahead and hit submit, and you're gonna get some information that pops up. So I'm gonna walk you through what all of this means because it can look like a lot in the beginning. So the first thing is this panel right here at the bottom of our question. And so it's going to tell us if we got the question right or wrong. So in this case, we got full credit. And then we're going to see this percent right here, which is going to tell us how many of the people who have taken this question in our bank have got it correct. And so in this case, 52.5% of our users got this question correct. So that's going to give you kind of an idea of how difficult this question is. We're going to see the scoring rule. So this is a 0-1 scoring rule because this is a multiple choice select one option or question. And then we're going to see our time spent. So this is a helpful little tracker for when we're taking practice questions, because we know that we have about 5 hours to take the NCLEX, and we can get a possibility of 150 questions. So if we do the math, that's about 2 minutes per question, right? So as we're going through our questions, we want to make sure that we're hitting at or below that 2-minute mark, so that if we were to get all of the questions on the NCLEX, we could finish that exam in time. Okay, so if we go over now to the right side of our screen, you will see what is our explanation. And so we have a lot of images embedded throughout our explanations for those who are visual learners. So in this case, you can see we're looking at serotonin syndrome and the symptoms that come along with this. So the fever, the sweating, confusion, agitation, muscle rigidity, tremors, increased blood pressure and heart rate. And then if we scroll further down, you can see we have the explanation as to why the correct answer is correct. And so in this case, we're talking about how SSRIs, like fluoxetine, block the reuptake of serotonin, and that could potentially lead to serotonin syndrome. So we need to be on the lookout for that. Okay. And then if we keep scrolling down, you will see that we have rationales for why our incorrect options are incorrect. And these are also really important to read because we have written these questions specifically not only so that you can learn from the correct answer, but also so that you can learn from the incorrect answers. So you will see here we're talking about continued reports of low mood and how SSRIs take several weeks to start working. And then we talk a little bit about the common side effects of SSRIs like headache, nausea, that type of thing. Now, if we keep scrolling, you will get to a section called our key takeaway. And this is also a really helpful section because it talks about what is the key concept you need to know about what you're being asked. And so in this case, we're talking about SSRIs and serotonin syndrome, and all the things you need to understand about serotonin syndrome and what that looks like. Now, why this is really helpful is because ultimately we can't predict what questions you're going to get on the NCLEX specifically, but we can predict themes. And we know that serotonin syndrome is a big safety concern when it comes to SSRIs. So we can say it's likely that you might get a question on serotonin syndrome. So if you understand kind of this key takeaway or these main concepts about serotonin syndrome, you'll be able to answer any question that they throw at you about serotonin syndrome because you kind of understand this big concept. Okay, so make sure that you always read these when you go through the question. And then if we go down even further, we have our Ask Bootcamp AI. So if you have any questions about this, you can put that here and our AI will give you back an answer, which is really helpful. And then if you still have a question, you can come down here and contact our team. And so this will link to the question that you're asking about, and you can send a message to our team and they will get back to you, which is also a really great resource. We love to hear from students, so don't be afraid to use this feature as well. Okay, and then the last thing I want to show you on our questions here is our tagging system. So you remember when I told you about when you go to make a test, you can pull from your tagged questions, and that is these down here. So we have either red means you're still learning it, yellow means you're reviewing it, and green means you've mastered it. So if we answered this question correct, it's going to auto tag it as mastered, as in we know this content, we're good to go, right? Now, say I just guessed on this and I wasn't really sure of my answer, and I still got it right. I could go down here and tag this as reviewing, which means I could come back to this question later. I could make a quiz just out of my questions I'm still reviewing. Now, if I got this question wrong, it's going to auto tag it as red, meaning I'm still learning this information. And so if I wanted to go back later on and make a test out of all the questions I've gotten wrong previously, I could do that as well. So it's just a really helpful way of sorting the questions and like sorting out the content that you know you're really solid on, you're good to go, and then kind of sorting that from the content where you still feel like needs a little bit more attention. All right, so that is our test bank. We have about 1,500 questions in there, so lots of learning to be had. And if we go on, we can see that we have case studies as well. So on your study schedule, you saw that there was case studies that you are assigned to answer day by day. So you can get some practice with those as well, because we know that the next generation NCLEX now has case studies. So fortunately, we have a lot of case studies for you to practice from. And I want to show you what these look like. So if we go back, you can get to our case studies again from two places. You can either come here and you can see we have a lot of case studies for you to practice with. And these cover all kinds of topics like adult health, mental health, maternal, child, critical care, all kinds of things. So you'll get plenty of practice. So if we take a look at what those look like, you will see these look very similar to what you're going to see on the actual NCLEX. So we have our client data tabs and the questions here on the right hand side. So all of our case studies have 6 items associated with them, which is what you'll see on the actual NCLEX. So in this case, this is a highlight type question. And so we would just go through here, and after we read our data tab, here we're being asked to select the 3 findings that are most concerning. So I'm just going to select, let's see, we'll select 3 of them. And then we're going to submit that. Okay. And so in this case, look at that, I got all 3 right. Okay, so it's going to give us the same dashboard we saw on our standalone questions. So I got 3 out of 3 credit, and I'm going to see that I spent about 1 minute on that question. So again, we're still aiming for about that 2 minutes or less. Now, the thing I really want to show you is that if we scroll down, we have case study walkthrough videos that go with every question of every case study. So for 50 case studies, 6 questions apiece, if we multiply that out, that's how many videos we have walking you through why the correct answer is correct and why the incorrect options are incorrect. And students really, really like these. They find them very helpful. So this is kind of like having like your favorite preceptor, your favorite instructor standing there with you, looking at this patient saying, this is why I'm concerned, and this is what I'm seeing, this is why I'm concerned, and this is how I got to this answer. And so students find this is really, really helpful in helping them learn to think like a nurse and helping them think in a way that will really help them be successful with these case studies. So here we have Dr. Emily talking about this question, and you can see all of these videos, they're going to be short. They're less than 5 minutes. So they're short, they're concise, they're to the point, they tell you what you need to know. So in 3 minutes, she walks you through this whole question. She's going to tell you what she's seen, why she found the concerning options concerning, and why the other ones she found as distractors. And then again, we have our written rationale for those who like to learn by reading. So it's going to tell you why the correct options were correct, why the incorrect options were incorrect. We're going to again have that key takeaway and the same Bootcamp AI. You can ask us questions. And so this is going to be the same thing for all 6 items of every case study. So students really have been enjoying that. We've got really positive feedback on those. Okay. And then the last thing I want to show you is our readiness exam. So you probably noticed in our study schedule, it was telling you when you should take your readiness exams. And usually you'll take 1 in the very beginning, 2 readiness exams, 2 and 3 in the middle, and then the last one before you take your NCLEX. And so these readiness exams, they're not just kind of a random compiling of a bunch of our questions. They're actually specifically written to match the NCSBN test plan. And so what I mean by that is that when you look at our readiness exams, they're going to simulate the types of questions you will see on the NCLEX. And by that, I mean 18% will be management of care, 14% will be physiological adaptation, 12% will be reduction of risk potential, and so on. So it's going to kind of match this pie graph. So let's take a look at what those look like. And again, you can get to those. They're right here under our standalone questions here on our left-hand panel. And you can see we have 4 readiness exams. So if we want to see what these look like, we can go over here and start the exam. All right, and so we have a couple things we can select before we get into our exam. So we can so it's going to tell us how long we have. It's going to tell us if we want to add the NCLEX restrictions. So that's going to disable that kind of cross out and highlight feature to simulate the real Pearson testing experience. And then if you have any time accommodations, you can go ahead and select that here to get extra time. Okay, so then we're going to start our exam. And this is going to look really similar to our practice questions, right? Because our practice questions look very similar to the NCLEX. So from here, we would just start reading through, selecting our answers, and going through. And you'll see when I'm clicking next, though, we're not getting that rationale pop-up because, of course, you wouldn't get that in the actual NCLEX. So we would go through here and answer all of our questions. I'm just going to answer a few so we can kind of get a sense of what this looks like. And I'm just kind of randomly picking, so I'm thinking I might not do very well. Okay, but we would go through to 100, but since you don't want to sit around and watch me click through 100 questions, I'm going to end our exam. And this is just telling me that I have some questions that are unanswered and if I'm sure I want to submit. I want to say yes, because I want to show you what you're going to get at the end of this. Okay, so say I went through all 100 questions and then I would get this kind of report card, if you will, at the end. And this is going to tell me, it's going to give me a lot of information actually. And it's going to tell me, first off, what my chances are of passing the NCLEX. So I'm going to get low, borderline, high, or very high. And in this case, I didn't do so well with my random clicking, and so I have a low chance of passing the NCLEX. But if I had gone through all 100 questions, of course, we would get a little bit more accurate of a prediction. So it's going to give us that. And then on the right side over here, it's going to give us our score. It's going to give us the average score of everybody who's taken this test. It's going to break down by points. It's going to tell us how much time we spent per question and a total time. And then under that, we're going to get a nice note from Dr. Emily telling us how we did and what we can do to improve our score. And then if we go down even further, it's going to break down this exam by subject. So pharmacology, management of care, fundamentals. And this is really helpful because it's going to show us what areas we did really, really well in and what areas might need a little bit more attention. So it will really help you focus your studying as you're moving through your NCLEX preparation journey. And then further down, it's going to give us a more detailed breakdown of the time we spent. So maybe adult health questions were more challenging for us, and we're going to see we spent a little bit more time on those questions. So again, just helping us focus our studying. And then it's going to give us a full breakdown of each question and which ones we got right and wrong. All right. So the last thing then that I want to show you is also our performance dashboard. So as you're working your way through the standalone questions, the case studies, the readiness exams, this performance dashboard is going to become more and more populated for you. And the purpose of this is it tells us, it's another indicator of how ready you are to take the NCLEX and be successful on it. So we say that we want you to meet 2 targets, and if you do, 99% of the students who have met these targets will pass their NCLEX. And so those seem like pretty good odds, right? So what these are is our overall score of our questions. So this is how well I'm doing on all the questions that I've answered. So here you can see as I've gone through some of our bank, it's at 51%. So we want to see you above 61%. But also we want to see that you've answered a little less than 1,800 questions out of our test bank. The reason we do that is say I come in here and I'm a mental health nurse, right? So if I came in here and I answered all the mental health questions and I did really good on them, say I was scoring at like 90% and I was like, yes, I'm doing great. Okay, but we know that I am probably going to see questions other than mental health on the NCLEX, right? So we want to be able to say that you've seen a broad enough variety of questions and you're still scoring over 61%. And then we can say that you're very likely to pass the NCLEX. And then again, if we scroll down, we're going to see that broken down by topic. So again, say I was doing great in mental health. I was scoring really, really high, but maybe maternal newborn, I wasn't scoring so well. And we're going to be able to see that here. And that's going to better help me focus my studying and which areas are going to need more attention. All right. And then I know I said the last thing already, but the last thing I want to show you, of course, is our cheat sheets. So these are a somewhat newish addition over the past couple months, and these, I must say, we are all very, very proud of, because our cheat sheets are going to be a great resource for your studying, especially in areas where maybe you feel like you're struggling a little bit more, because they give you all the information you need to know for the NCLEX and nothing you don't. So it's really synthesized down complex topics into really digestible, easy to understand information that are very applicable to the NCLEX. So let's take a look at what some of these look like. So you can separate these out. We have adult, child health fundamentals, management of care, mental health, pharmacology. So you can divide them out by topic. So let's take a look at, let's do COPD, right? That's a common condition we see on the NCLEX. So you can see that these are synthesized out into a really easy, what am I going to say? A very readable way of studying for the NCLEX. So if we keep scrolling down, you can see it's going to cover all the high yield topics of the things we need to know. And then you'll see that they have these little star points. And these are call outs. So things that are really important to know for the NCLEX that you're likely to see come up. And then if you look at the bottom of each page, you're going to see what's called our NCLEX star points. And so these are kind of similar to our key takeaways from our practice questions. And so these are going to tell you these really high yield points that are really likely to come up on the NCLEX. And then at the very end of our cheat sheets, you can see that you're going to get the chance to test your knowledge. So you can go ahead and answer these questions just to help this information sink in, make sure you remember it, and make sure that you're understanding the content. So again, these cheat sheets, you can find them here, right underneath our readiness exams, and new ones are being uploaded every week. So this list is only getting longer with the amount of topics that you have to choose from. So again, a really, really helpful study resource as you're preparing for the NCLEX. All right, so additional resources. So today we are live here on YouTube, but if you are also a Facebook user, you can go over to our Facebook study group. If you're already a member, you can hit that invite button and invite any cohort members or friends that you have who are also studying for the NCLEX, so they can utilize our resources as well. We do live weekly webinars. So last week, I believe it was Dr. Amber Adams who gave a lovely presentation that is archived on our YouTube page. And then next week, I believe we have Dr. Emily coming up with her Ask Me Anything webinar, so you can get all of your burning NCLEX questions answered. And the date and time for that will be posted in our Facebook page and on our Instagram as well, which you can find here. So you can follow us on bootcamp.com, or you can find us, on bootcamp.com/NCLEX. We're on Instagram, TikTok, YouTube, Facebook, all of those. And we love to hear from students. So make sure that you pop in and tell us hi and follow us. Of course, you can start studying on NCLEX Bootcamp for free. If you decide that you do want to upgrade to an all-access pass, you can find that here. And Emily's going to be dropping those links for you in the chat. And you can pick from a 1 month, 3 month, or 6 month access, depending on when you're taking your NCLEX. Okay, so that I think wraps us up, and there we go. I will hang out for a few minutes if any of you have any questions, and Emily is going to be in the chat answering any questions that you might have as well. And thank you so much for joining us today. I hope that you found this helpful, and I want to wish all the best of luck to those of you who are taking your NCLEX soon. I'm sure that you will do great. And if you have any questions, make sure that you post them in the chat for us. All right. Well, thank you so much, everybody. It was great to hear from you, and I will see you in the next webinar. All right, take care.